Okay friends, so this video will be the last video lecture of Haemophilus influenza. So today we will going to discuss about how we can treat Haemophilus influenza. Okay, so if you are new in this channel, then I would like to recommend you to please go and watch my previous video lecture series of Haemophilus influenza. Then it will help you to understand what I will going to told you here. Okay, and if you have basic knowledge in Haemophilus influenza, that what kind of strain causes infection in Haemophilus influenza and how they cause Haemophilus infections, what type causes more invasive disease and what causes less invasive disease, then it is okay, you can continue with us from that video. Okay, so let's start. So Haemophilus influenza type B. So we have already discussed that only two strain causes infection in Haemophilus, causes infection from Haemophilus influenza, right? So one is Haemophilus influenza type B and another one is Haemophilus influenza non-typeable. I have told you that Haemophilus influenza non-typeable means that type of Haemophilus influenza which lacks capsules, right? And Haemophilus influenza type B is named depending on the type of the capsular antigen present on the capsular polysaccharide, right? So these two strains causes infection in Haemophilus influenza. So first we will going to discuss about the drugs and vaccinations available for Haemophilus influenza type B. Then we will move on the non-typeable. Okay, so I have also told you in my previous video lectures that Haemophilus influenza type B, due to their presence of capsule, have the ability to cause more invasive disease, right? So the most biggest threat of Haemophilus influenza type B infection is meningitis. Okay, so meningitis are treated with ceftriaxone and chloramphenicol. Okay, so I have, if you also have watched my antibacterial video lectures, antibiotics video lectures, then I think you know that I have also discussed about the mechanism of the chloramphenicol, right? And in that video lecture I have also told you that chloramphenicol is a protein synthesis inhibitor, right? So if you want to know about how chloramphenicol inhibits protein synthesis, then I would like to recommend you to go and watch my antibacterial video lecture series, then it will be very clear to you. Okay, so now along with chloramphenicol and ceftriaxone, there are some vaccinations available. Okay, so this vaccination is nothing but a solution containing type B conjugated type B capsular polysaccharide. Okay, and also the type B capsular polysaccharide is conjugated with diphtheria toxin here. Okay, so not the toxin, it is toxoid. So I hope you know about toxoid, that it is nothing but a inactive form of the toxins that is used to create immunogenicity, right? So this kind of vaccine, that is the mixture of type B capsular polysaccharide and diphtheria toxoid, is recommended for between age of 2 to 18 months. Okay, and using of this vaccine decreases the incidence of the Haemophilus type B meningitis. Nowadays you can only see the Haemophilus influenza type B meningitis in unimmunized children only. Okay, so now another important treatment that is done for Haemophilus influenza type B infection is the chemoprophylaxis by using rifampin. Okay, and rifampin, I have also discussed about rifampin, that is RNA polymerase inhibitor. Okay, I would again like to recommend you to go and watch the video I have uploaded on the basis of DNA RNA synthesis inhibitor, that is there I have mentioned about rifampin. Okay, so that is all about Haemophilus influenza type B drugs. We can use chloramphenicol, we can use the ceftriaxone. Okay, and we can also use chemoprophylaxis by using rifampin. Okay, and vaccinations are also available. This vaccination is nothing but type B capsular polysaccharide conjugated with diphtheria toxoid. okay, and it is recommended for age between 2 to 18 months, okay. So now, after discussing about the type B Haemophilus influenza infection inhibition drugs, now it is time to discuss about Haemophilus influenza non-typable drug, okay. So Haemophilus influenza non-typables have the ability to only cause mucosal infection, right? I have also discussed with you about this. So this mucosal infection can be inhibited by amoxicillin. This amoxicillin is a cell wall inhibitor. You can also watch this in my playlist of antibiotic. And this amoxicillin, there I have told you that it is very sensitive to beta lactamase, right? So it is often suggested to use clavulunate, or in that video I have mentioned this one as a clavulonic acid. Both the two things are same, okay. So you can use clavulunate to protect amoxicillin, so that amoxicillin can show its activity, because don't forget, amoxicillin is a beta lactam antibiotic, right? So if you add amoxicillin only, then the beta lactamase that mainly gram negative bacteria have, due to presence of plasmid that they have acquired, so as a result this beta lactamase will simply degrade the beta lactam ring of the amoxicillin, and as a result amoxicillin can no longer be active, okay. So for protecting amoxicillin from beta lactamase, you have to use clavulunate or clavulonic acid. This clavulunate is acting as a beta lactamase inhibitor, okay, and allow amoxicillin to do its job fantastically, okay. And this is used as a first line drug. You can also use second and third generation cephalosporin. So I think you can remember that second generation is used for gram positive infection treatment, and third generation cephalosporin is used for gram negative infection, right? Along with, you can use macrolides, you can use fluoroquinolone as an alternative, okay. So that means Haemophilus influenza non-typable is generally treated by a type of antibiotics named amoxicillin. This amoxicillin have to be mixed with clavulonic acid. This clavulonic acid is nothing but beta lactamase inhibitor, okay, that inhibits the beta lactamase present in the bacteria that have the ability to destroy amoxicillin. And if still it not works, then you can also use second and third generation cephalosporin along with fluoroquinolone and macrolides. So that is the treatment for Haemophilus influenza. For type B type infection, we are using chloramphenicol and ceftriaxone, and we can also use vaccination for this, and also the chemoprophylaxis by using rifampin, okay. And for Haemophilus influenza non-typables, you can use amoxicillin along with clavulunate for protecting amoxicillin, and if still it not works, then you can use third and second generation cephalosporin, macrolides, fluoroquinolone as alternative, okay. So that's it for today, friends. So I hope this video will be helpful to you to understand about what kind of treatment available for Haemophilus influenza type B and non-typables. So till then, bye bye.